Good
afternoon, sir. Sir, can we start?
Good morning, sir.
Good morning. We will start within a few minutes, madam.
Okay, sir.
If Nalini is ready, Nalini?
Yes, sir, I am ready, sir.
We will start.
Okay, sir. So, good afternoon, one and all. So, let's start this program with the prayer. Gently close your eyes, spine erect, hands in Namaskara Mudra. Observe your breath.
वक्रतुण्ड महाकाय सूर्यकोटि समप्रभा निर्विघ्नं कुरु मे देवा सर्वकार्येषु सर्वदा तेजस्विनावधीतमस्तु मा विद्विषावहै ॐ शान्ति 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 भूर्भुवस्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात् ॐ शान्ति शान्ति शान्ति
So, very good afternoon to one and all. So, on this auspicious day, we have gathered to celebrate National Science Day 2022. So, the Government of India has organized a week-long celebration titled VIGYAN Sarvatra Pujyate celebration, which means science is revered everywhere. So, VIGYAN Sarvatra Pujyate is a week-long nationwide program of competitions and lecture for school students and collegians. It was inaugurated by our President Ramnath Kovind on February 22, 2022. The VIGYAN Sarvatra Pujyate program was launched with the aim of attracting students towards the scientific knowledge of articles of daily use. The program also aims to propagate the scientific theories. So on the eve of National Science Day, it is observed, the National Science Day is observed in India on February 28 every year. The day marks the discovery of Raman effect by Indian physicist Sir C.V. Raman. The Raman effect was discovered on February 28, 1928, for which Sir C.V. Raman had received Nobel Prize in Physics in 1930. The science is very important in each and every field. Without science and research, there would not be any growth and development. It applies to our yoga as well. To become a successful yoga therapist or yoga teachers, it is very important to understand the scientific concepts related to yoga along with the philosophical knowledge. So today we have our chief guest, Professor Dr. Muthulakshmi Parandaman, who is going to deliver special address on physiological benefits of yoga as part of VIGYAN Sarvatra Pujyate celebration culminating with National Science Day 2022. So now, on behalf of Faculty of Yoga Sciences and Therapy, MAHER, it's my privilege to welcome each and every one of you to this wonderful Science Day celebration. Thank you. So now, may I request Dr. S. Murugesan, Associate Professor, FIST MAHER, to deliver the welcome address.
Audible, ma?
Yes, sir.
Good afternoon, one and all. Present in this online meeting to participate in the VIGYAN Sarvatra Pujyate celebration, culminating with the National Science Day. The National Science Day is celebrated in India on 28 February each year to mark the discovery of Raman effect by Indian physicist Sir C.V. Raman on 28 February 1928. Our university takes pride in celebrating this National Science Day. On this auspicious occasion, it gives me pleasure to welcome our beloved HOD Dr. R. Ilangovan sir, Faculty of Yoga Science and Therapy. The force behind the program, welcome sir. It is a honor to welcome our chief guest, Professor Dr. Muthulakshmi Parandaman, Vice Principal and HOD Department of Physiology, Meenakshi Medical College, Hospital and Research Institute, Kanchipuram, who has accepted our invitation and request to deliver her special address on the topic physiological benefits of yoga. Welcome, ma'am. Now I welcome my colleagues, Dr. V. Subbulakshmi, Associate Professor, Mr. A. Anatharai, Assistant Professor, FIST MAHER, and research scholars, students of MAHER. I once again welcome one and all. Welcome you all. Thank you.
Thank you, sir. So now it is special address by Professor Dr. Muthulakshmi Parandaman. So before inviting her, I would like to deliver a small introduction about her. Professor Dr. Muthulakshmi Parandaman is the Vice Principal of Meenakshi Medical College and Head of the Department of Physiology. She is the former Dean and Vice Principal of Government Vellore Medical College and Hospital and former MCA Inspector for UG and PG. Her educational background was MBBS at Government Kilpack Medical College, and she has completed DGO at Government Madras Medical College, and she has done her MD at Government Stanley Medical College. She is having more than 17 years of clinical experience and 23 years of teaching experience in government sectors. And also she has very good administrative experiences as a Medical Council of India Inspector and as a University Inspector in various university and colleges, which includes the MGR Medical University, Christian Medical College, Vellore, JIPMER, Puducherry and Pondicherry universities. She also attended various number of national and international conferences, and she has published more papers. And she is the honorary member of so many associations, which includes the Tamil Nadu Women Doctors Association, and she is the life member at Indian Association of Biomedical Scientists, and she is the life member of Association of Physiologists and Formalists of India, and she is also the life association member of Physiologists of Tamil Nadu and Pondicherry. So along with this, I would like to say she is a very simple person and she is the great yogini who used to practice yoga, especially the pranayama practices. So with this small introduction, so on behalf of FIST MAHER, it's my honor to welcome our chief guest of the day, Professor Dr. Muthulakshmi Parandaman, to deliver the special address. on physiological benefits of yoga. Welcome you, ma'am. Ma'am, you are in mute, ma'am.
Thank you. Thank you very much for your kind words and appreciation. Thank you, sir. Dr. Before going to the talk, I have to congratulate the entire team of yoga under the guidance of Dr. Lelangavan sir. Is a very dynamic, active, enthusiastic, dedicated principal. So under the guidance of him, the organizing team of yoga, you did a wonderful job. Daily you are conducting one-on-one programs. Today we are celebrating the National Science Day. I have to thank, first of all, I have to thank the Almighty for arranging all the things, and I thank our trustee, managing directors, Rector ma'am, Vice Chancellor, and Register ma'am for given the opportunity as a platform in this program. So, I should be thankful to the whole MAHER University. Today, I am going to talk about the National Science Day, how it is related to the, what are the benefits of yoga, physiological benefits of yoga. So before that, the yoga is we emphasize the importance of connecting the yoga. So today's this year theme is integrated approach in science and technology for a sustainable future. So what do you understand by sustainable future? நிலையான எதிர்காலத்திற்கான அறிவியல் தொழில்நுட்பத்தில் ஒருங்கிணைந்த அணுகுமுறை. So this is we emphasize the importance of connecting the yoga knowledge and practice with the modern medical approaches to improve the quality of life. So yoga is a system of perfect tools for achieving union as well as healing. So all of you know, because the yoga, you know how this improves the so how it improves the health of the human body, because yoga is a psychosomatic discipline for achieving union
Sorry for the
and
interruption,
harmony.
ma'am. Ma'am, slide is not moving, ma'am.
No,
You can-
now only I'm showing
Okay,
the slide. Yoga, are you able to see the slide now?
Yes, ma'am. We can see the first page of university.
Yeah. University, this is, are you able to see this
Yes, ma'am.
now?
Yes, ma'am. We can see the university picture. Thank you, ma'am.
This yoga is a psychosomatic discipline for achieving union and harmony between mind, body, and soul, and ultimate the union of our individual consciousness with the universal consciousness, that is man and nature. So science. So all the systems of the body are stimulated and balanced by practicing yoga. So emotions also can be controlled by regular practice of yoga. So how it is related? Because this is the harmony, integrated approach. This year theme also integrated approach in science and technology for a sustainable future. நிலையான எதிர்காலம். So the yoga is also a integrated union between the mind, body, and soul. So ultimate union of our individual consciousness with the universal consciousness. So yoga not only related to only cautious and also controlled breathing, pranayamas, concentrating the thoughts, meditation, and recitation of praises, mantras. So yoga makes the individual to experience good health, happiness, and improves the quality of life.
I'm sorry for the interruption. The slide, we can see the first slide, ma'am.
Oh, you are not at all.
Yeah, the slide is not moving, ma'am.
Ma'am, you please try to reshare. Go back and again choose screen share option, ma'am.
What, ma'am?
Go back and then again you try share option. Whatever steps you did in the first, just repeat that, ma'am. Cancel sharing now. Then again go and choose screen sharing option.
Share, no, this.
Ma'am, can you press the arrows in the side? Or directly you can click the second slide.
No?
Yes, ma'am.
Yes, ma'am. You are successful, ma'am. Thank you.
Thank you. Now?
Yes, ma'am. Now it is moving.
Yes, ma'am. Yes, ma'am. It is moving. The to full screen option. Thank you, ma'am.
Thank you, because I'm very poor in this connection.
No problem, ma'am. It's a learning step only. Nice.
Okay. Thank you. So yoga includes cautious, controlled breathing, pranayamas, concentrating the thoughts, recitation of praises. So it makes the individual to experience good health, happiness, and improves the quality of life. Okay. So what are the benefits of yoga? Already all of you know the yoga. If you are doing the yoga, that will improve the arthritis, that will improve the diabetes, improves the hypertension, cardiac disease, and well-being. All the things we know by doing the yoga. But what are the physiological basis for this? How to improve the arthritis? How to improve the hypertension? That is the thing I am going to talk today. So that is the physiological basis. How the yoga improves the strength, balance, and flexibility by slow movements and deep breathing. You are doing slowly, and you should not be hurried movements, and you have to take slow movements as well as deep breathing, increase the blood flow and warm up the muscle. Thereby, it will be easing the arthritic pains. So gentle yoga can ease the even discomfort of tender swollen joints. Usually we'll say, don't do the yoga when the acute conditions, severe conditions, if we are having painful swelling joints and during that time we should not do. But after that, there will be a simple movements. Slowly we are doing the movements and deep breathing also. That will increase the oxygen saturation to the tissues and cells. So thereby the muscles will get the oxygen supply as well as the blood flow, required nutrients to their muscles. Thereby the muscles will be relaxed. So the joints will be very easy, flexible. If you are doing this tripod posture, see the bending. They are also flexion of the knee joints as well as elbow joints. So the movements will be very easy. So thereby that will improve the arthritis. And also it will be helpful in back pain. Mostly in back pain is all the people are facing the back pain. So the back pain will be the first line of treatment in American College of Physicians, they are giving the first line of treatment itself, chronic for low back pain, the exercise, the yoga. So cat-cow posture. This is the cat-cow posture. Basic stretching improves the mobility and release the pain. So if you are doing the simple exercise, yoga asanas, that will improve your back pain. So I am experienced this by doing the stretching of this by supine posture and doing this type of cat-cow posture, that will improve the pain. Okay, so back pain will be relieved by a simple doing exercise, that will also improve the circulation and the mobility, movements of the joints will be improved, and the arthritis as well as the back pain will be relieved. And how the heart in cardiovascular conditions, how the heart failure, heart patients, cardiovascular patients are suffering from ischemia. Sometimes the patients will have failure. All those patients, it will increase the efficiency, cardiovascular efficiency, by decreasing the heart rate and blood pressure. How it will decrease the heart rate? Heart rate due to contraction and relaxation of the heart. And the blood pressure is nothing but the vascular constriction, the narrowing of the blood vessels, that will increase the blood pressure. So by doing this yoga, it relaxes your blood vessels, and the pressure also will decrease, and that will decrease the heart rate by stimulating the baroreceptor reflexes. The baroreceptor reflexes are present in the carotid sinus and the aortic arch. Carotid sinus is the small sinus that is present in the carotid artery, and the aortic arch, the baroreceptor will present. That will sense the stretching of this arch and the sinus. So by stretching, this will sense the signal to the cardiomotor area that is present in the medulla, that will stimulate the sympathetic and the parasympathetic nerves. So by doing yoga, all of you know the parasympathetic will be very dominant. That is, parasympathetic will be carried by the vagus nerve. By stimulating this parasympathetic nerve, the heart rate, the impulse produced in the SA node itself, it is reduced. So the impulse is reduced, the conduction also will be reduced. So the contraction of the heart will be reduced. Okay, so thereby decreasing the heart rate. And also when the blood flowing through the blood vessels also will be dilated, thereby decreasing the blood pressure. So this is thereby that will increase the baroreceptor sensitivity. So the baroreceptors are nothing but the carotid sinus and the aortic arch, due to stimulation of the stretch or the pressure, the volume, that will sense the receptors. Okay, so also it relaxes and sleep better. So during oxygen consumption decrease during meditation. If you are doing the meditation, the oxygen consumption, instead of taking 16 breaths per minute, doing the yoga meditation only 5 to 6 breaths per minute. So during that time, if you are doing slowly yoga, the oxygen, the diffusion of oxygen in the alveoli will take longer time. So the oxygen delivered to the tissues will be more. So the oxygen consumption during meditation by the air atmosphere is less, but distribution of oxygen to the tissues will be more. So thereby relaxing the muscles and all the things, so you can sleep better. And how it relieves the stress and anxiety. Now coming to the stress and anxiety, all the people are exposing to stress. So this is also, it will stabilizes how the anxiety and stress are related. It stabilizes the autonomic activity. So autonomic nerves are nothing but the sympathetic and the parasympathetic nerve. If you are stimulating the sympathetic nerve, there will be an increase of actions. That is fight, flight, fight reactions. That is stimulation of the sympathetic nerve endings. Parasympathetic, that is the vagus. So stimulating the vagus, that will decrease, opposite effect. So the stress and anxieties are relieved because of the parasympathetic dominance. Okay. In EEG, that is electroencephalogram, alpha waves, beta waves, theta waves, delta waves are present. So this, by doing the yoga, that will increase the slowing, these waves will increase, theta waves and delta waves will be increased and showing the relaxed state of mind. How this will relax? The delta waves will be in the deep sleep. You will have the theta and delta waves in the deep sleep. So this will use minimal sensory input and motor input and leads to the improvement of higher intellectual activity. So thereby, it will, the sensation carried to the brain itself, sensory impulse carried to the brain itself will be decreased. So in the anxiety and stress, there is the increased sensation going to the brain. By doing the yoga, it will reduce the sensory input, thereby giving the motor input to the output to the concerned organs. That also will be decreased. Thereby, it will increase the intellectual activity, that is improvement of intellectual activity, that is you can have the relaxation of the stress and anxiety. Then how the yoga improves smoother respiration. So by doing the yoga, there will be a, here also the parasympathetic dominance and decrease the sympathetic activity. So if you are prone position, if you are doing this, that will improve the breathing, oxygen saturation, oxygen. If you are during the COVID time and all, the position itself is the prone position, not the supine position. So the prone position itself, that will improve your oxygen saturation, oxygen delivered to the tissue will be increased. How this will be increased? Because the parasympathetic dominance and decrease the sympathetic activity. And if you are increasing the breath holding time, the respiratory rate also will be decreased and increases the breath holding and maximum breathing capacity and tidal volume. Tidal volume is nothing but you are taking normal inspiration and expiration, 500 ml. The vital capacity, nothing but you are taking maximum deep inspiration and forceful expiration. That is the vital capacity. And respiratory efficiency. If you are taking deep inspiration and holding for 2 seconds, during that time, the diffusion of the oxygen to the tissues will be increased. So after that forceful expiration, whatever amount of carbon dioxide coming to the lungs, that will be forcefully expired. So the holding the breath, that will use the maximum diffusion of oxygen to the tissues. So by doing the yoga, you are taking deep inspiration, holding, and after that maximum expiration. So the breath rate, breathing rate itself, it is decreased per minute. So thereby decreases the respiratory rate and increases the breath holding time. Because of breath holding, the oxygen diffusion to the tissues will be more. So thereby it will increases, that will improve the respiratory rate and chronic obstructive pulmonary disease and all those things. There will be a dyspnea, difficulty in breathing. How this will improve? By doing this action only, by parasympathetic dominance. So there will be the decreases the respiratory rate. Now, coming to the diabetes. How it will control the diabetes? That will be yoga controls blood sugar level. Diabetes is nothing but the sugar will be increased in the blood. But how this sugar should be utilized by the cells, by the insulin. Okay, so the regeneration of beta cells of pancreas. Beta cells of the pancreas only producing the insulin. If the insulin is present only, the whatever sugar that is present in the blood vessels will be utilized by the tissues. For that, insulin is necessary. Suppose the insulin is not secreted by the beta cells, the whatever sugar that is present in the blood vessel will be remain in this, so the blood glucose level will be increased. So by doing the yoga, this cobra's pose, you are doing like this stretching, regeneration of the beta cells of the pancreas will take place. So the beta cells only producing the insulin. So your abdominal stretching exercise like cobra pose like this, there will be regeneration of the beta cells of the pancreas. So there will be increased secretion of insulin. So the insulin is used for utilization and metabolism of glucose. So the peripheral utilization of glucose. Peripheral utilization is nothing but the utilization of the glucose by the peripheral tissues, liver and adipose tissue through enzymatic process. This peripheral utilization is increased. So the glucose level in the blood will be decreased. So the yoga, simple by stretching exercise, how it improves? Regenerating the beta cells of the pancreas, thereby increase the secretion of insulin, thereby reducing the glucose in the blood. Thereby it will controls the diabetes. Okay. Then how it improves the digestive health? Suppose after taking food, you'll have some fullness, or you are not able to pass the motion or gas. So there will be a fullness of your abdomen. So how the yoga will increase? How the yoga will relieve these problems? Yoga improves their digestive health by increasing the blood flow to the gastrointestinal tract. How it will increases? How it will? Because after taking food, there will be a more amount of blood is going to your GIT. That's why you should not do strenuous exercise after taking food. Why? Because during that time, after food, there will be a more amount of blood should go to the intestine. Then only the digestion and absorption takes place. If you are concentrating more on exercise after food, that extra blood will go to the muscles. So we can't digest and absorption of food not takes place. That's why after taking food, you should not do the yoga practice, because there should be a more amount of blood should go to the GIT. Then only there will be a proper digestion and absorption. And it will stimulate the peristalsis. What is peristalsis? That is movement of food from oral to aboral side. So it will stimulate the movement of the food from oral to aboral. That is towards the anus. So by doing the yoga, the food is properly digested, because more amount of blood is going to the GIT and it is absorbed. So the movement also from oral to it is aboral side. So relaxes the digestive system and leads to more effective elimination. So proper digestion, proper absorption, then there will be a proper peristalsis movement. So there will be a more effective elimination. So the digestive system gets relaxed. So there will be a proper digestion, absorption, and effective elimination by doing this Pavana Muktasana. Okay. So this will be improving the digestive health. Now coming to how yoga connects with supportive community. All of you, if you are doing yoga, you will be benefited. but proper education must be there. So all the people unite together. We are going to the yoga center and learning. So this participating in yoga class itself, we are meeting more people that will relieve the loneliness and provide an environment for group healing and support. So by seeing all the people, those who are coming with some problems, we are discussing. So we are communicating with each other. So that will itself will relieve the loneliness, and it will provide a good environment for group healing. So we are discussing. Suppose you are doing this type of yoga, I am easy with the arthritis, I am having the problems, the dyspneic and everything is relieved. So we have to do yoga like that. We are hearing from other people are talking also. So that will have the group healing and supportive measures like that. By somebody is saying an experience, I am feeling better like this, that itself gives the support. So that will prevent the loneliness. So by doing how yoga is connecting with the supportive community. So overall, we are doing yoga. This will generate overall well-being and bringing union of body, mind, breath, and soul, helping the people to eat better, sleep better, and deal with pain, anxiety, improving overall strength and resilience, contributing in a better quality of life. Thank you. Thank you for patiently listening. Thank you, sir, for giving the opportunity to talk about the physiological benefits of yoga. If you have any doubt, we can ask. Thank you, sir.
Audience, if you have any doubts, kindly ask your questions. Thank you so much, ma'am. Really, within this short time, we can see all the human system in the single within the half an hour. We can able to refresh all the concepts like it's even the vagus nerve, baroreceptor, chemoreceptor. So many things. Really, it was a feast to our ears. Thank you so much, ma'am. And
Nalini, you allow anyone, if they have any doubt, let them ask, madam.
yes,
You
sir.
remind them, our students.
Yes, sir. Students, if you have any doubts, please post your questions on the chat box or directly you can ask.
Parvati,
Mainly, the student must know these are the benefits of the yoga. You have to say only one word, that is one line, parasympathetic dominance. Because what is parasympathetic? You must know. What is sympathetic and parasympathetic? Parasympathetic dominance itself, that will reduces the vagus, that is by vagus nerve. That will reduces the cardiac impulse, that is the conducting system of the heart and the contraction of the muscles and the heart, as well as it will relax the blood vessels, everything put together, that will reduces the heart rate, blood pressure, as well as the breathing rate, respiratory rate also it will decreases. That is the important thing you must know for the all the people, those who are listening this, and for the students also. So this is the take-home message. What is the effect of yoga? What are the physiological benefits? Means that is mainly parasympathetic dominance. That will relaxes the mind as well as, because that will reduce the impulse formation itself. So the stimulation going to the brain itself also will be reduced because of the parasympathetic dominance. That is the take-home message.
Okay, ma'am. So there is two questions, ma'am, from the
Yes.
audience. So the one is, what is your view on the yoga and balancing the hormones?
Hormones. What hormones? All that, because the adrenaline,
For example,
noradrenaline.
female have something like the PCOS and so many problems.
Yeah.
So what is
Because that also because of the stimulation, adrenal steroid hormones, ovarian estrogen, progesterone, these hormones also will be stabilized even for DUP, dysfunctional uterine bleeding. Now we are saying abnormal uterine bleeding, and everything that is due to your anxiety. So the adrenaline, noradrenaline, that and all will be decreased. This will be, hormones will be stabilized because of mind relaxation, and the blood vessels also relaxed. So the flow will be decreased. Even PCOD, that also will be due to steroids. Cushing syndrome and PCOD are interconnected with the hypothalamus pituitary ovarian axis. Okay, so this will be stabilized the your anxiety. So thereby it will decrease, that will act on the uterus. So the uterus also will be having the hormones that is acting on the uterus, and the ovaries also will be the normal level. So decreased, that is no over stimulation of this.
Thank you, ma'am. So the next question is how the yoga helps for the pregnancy. So what is your opinion on that?
So during pregnancy, the yoga, if you are doing slight yoga exercise and all exercise, you should not do the strenuous exercise. You have to do the simple exercise for stretching and movements. If you are doing, that will improve the blood circulation. Okay, the uteroplacental circulation from the mother to the fetus only, the blood is circulating. No, so the movement, blood circulation, this exercise, this will relaxes the, it will not constrict the blood vessel that is going from the uterus to the fetus. So it will relaxes the blood vessels. These hormones also, like that, it will relaxes. So the blood flow to the fetus will be increased. And the chanting, the pranayama, chanting also, we are doing, the baby is listening, the sensation that will listen. That's why we are doing the slight small asanas, that is easy. Not the strenuous exercise, as well as some melodious songs that will be peaceful to the mind. So the baby is also listening like that. So that way it will increase the pregnancy will be easy. So the blood flow is increased, and joints mobility will be increased. So during we are expecting the normal deliveries.
Okay, ma'am. So regarding pregnancy, they have asked what trimester we can start yoga.
And that now they are from the beginning we have to do some yogas, not only during the third trimester. From the beginning itself, small exercise. After that, advancing pregnancy, you have to restrict this, and you have to do the walking and the simpler exercise. So not a particular this pregnancy trimester. Starting from the early pregnancy, start doing, because the early pregnancy will have some nauseating, vomiting, all the symptoms and all those. So if you are doing simple breathing exercise, so the oxygen given to the tissues and the brain will get, because our brain needs only oxygen and glucose. So in the early trimester and all, we need more and more oxygen and the glucose for the brain. So we are having nausea, vomiting all the time. So we are doing this simple yoga breathing exercise that will improve your brain activity. Because so along with this, some juice like that, if you are taking, that will improve the health. Okay, so I think from the beginning you have to do the exercise.
Okay, ma'am. And I think many questions are coming. So the next question, what is the reason between L4, L5 problem and the uterus bulge? From the question from Srimati.
L4, L5 problem?
And uterus bulge.
Because the nerve supply to the uterus. Okay, usually the low back pain, usually we'll say the pain, the uterus is supplied by the thing L4, L5 in that region that supplies the uterus. So if you are having them during the pregnancy pain, to labor pain, the pain will start only in the back. That is the low back. Then it will radiate towards your uterus and the cervix, the dilatation of the cervix and all. So I think this is related to their low back pain.
Okay, ma'am.
That is
So-
related to your
Oh,
uterus.
back pain, yes. And another question from Rajashekar. So, which practices for chronic kidney disease? It means
Which practices
uh,
for
chronic kidney disease. For example, you have told for lower back pain, we should focus on the supine resting or hip openers. The
Yes.
same way for the kidney disease, what could be our focus or what all are the practices we can follow?
I think kidney, it is a retroperitoneal structure. Okay, if you are doing the everything, I think it is also due to this prone position that will improve the circulation to the kidney. Kidney is getting 1/4 of the cardiac output, 1250 ml per minute. So that is going, if you are doing the prone position, the thing with the blood flow to the kidney will improve. So that way it will improve the thing, I think. So sir only have to say what is that posture, how that will improve that. I thought of this is 1/4 of the cardiac output blood is going to the kidney, and it is also retroperitoneal structure. So if you are doing that posture, that will improve the circulation and the kidney.
Thank you, ma'am. And one more final question. So, because the many women, they used to get the rheumatoid arthritis or arthritis after the pregnancy, the autoimmune disorders.
Yeah.
So, if the pregnancy is the result or something for the autoimmune diseases?
Not the pregnancy is not the reason for autoimmune disease. Pregnancy is a physiological phenomenon. It is not a pathology. Okay, because of that, during the pregnancy, what are the problems they underwent? Because they developed some disease, not but after pregnancy, all the people won't get your rheumatoid arthritis, all the things. That is not due to pregnancy. It is some other things. Even myself will have the joint pain and back pain, everything after this thing. That and all not due to pregnancy, some complication. After that, after delivery, they are not immobilized the patient, they won't walk, they will take care. So they simply rest in the bed, they will lie down without doing it. That's why after delivery, he asked us people to do some active not walking, and you should not simply lie down in the bed. So by some small exercise, walking and sweeping, all the things we are doing after delivery, that will improve the blood circulation. It will not lead to some arthritis or autoimmune disease at all.
Okay, thank you so much, ma'am. And another question from Parvati: which pose is better for sleeping, Shavasana or Makarasana or any another pose?
This is I used to say left lateral position. Usually the left lateral position for the pregnant ladies as well as for all the people, I used to suggest a left lateral position, or now it is very well said because of COVID prone position. Why is the left lateral position? The inferior vena cava, the main input to the your heart. That is inferior vena cava. The blood that is deoxygenated blood is coming via the inferior vena cava to the right heart. Right heart carries the deoxygenated blood and left heart carries the oxygenated blood. So the inferior vena cava is coming via the right side of the heart. So right side. So if you are lying on the left lateral position, this will improve the coming of the deoxygenated through the right side to the heart. Okay, suppose you are lying down in the right side, you are compressing the inferior vena cava. So the blood that comes to the heart will decrease. So that's why the normal position for lying down is in the left lateral position or in the prone position also. That will improve the blood flow to the heart. Thereby the cardiac output will increase. Okay. The prone position, the coming of the blood through the inferior vena cava is also increased. After that, from the right heart, it goes to the pulmons, right side of, left side of the lungs. There get purification, that oxygenation. After that, this will comes to the your left side of the heart. For that, that is a prone position. That's why if you are the prone position, the taking deep inspiration and expiration, the flow of blood from the all the inferior and superior vena cava, inferior vena cava, the blood flow to the heart will be more. So because of that, from the heart it goes to the your lungs, and there get purified, and again the purified blood, that is oxygenated blood, comes to the left side of the heart. From the left side of the heart, from the aorta, it goes to all parts of the body. So all the parts of the cardiac output, that is cardiac output, that will be increased. So the oxygenation to the tissues, nutrition to the tissues, that will be increased.
Thank you so much, ma'am. And thank you for answering all our questions very patiently. And thank you so much, ma'am. So now may I invite Dr. R. Ilangovan, Professor and Head, FIST MAHER, to deliver concluding remarks.
Thank you, thank you. Because of sir only, because he's a right person identifying the right people, and he's very involvement, the dedication he is having. That's why you are choosing all the people and giving a good thing also. Excellent programs you are arranging, sir. Congratulations once again, the entire team of yoga under the head of you, sir. Thank you, sir.
Thank you very much, madam. Good afternoon to one and all. Really, it is a red letter day for us. It is a historic day in our FIST history. As you know very well, by presenting her paper and also answering the questions patiently and intelligently, intellectually, you can understand how much she is very popular. Really, she is an extraordinary personality in Western medicine, and also keeping our own cultural heritage. She is inexhaustive source of wisdom and knowledge. Inspirations to many we can understand from her biodata. Such an experienced person we are having in our MAHER. Really, we feel proud, and you are our super pride. At this juncture, we express our sincere thanks that your many fellow doctors are attending this program, very particularly Dr. Rajkumar Rajamanikam, and also Dr. Kayal Viji and others, and including Annamalai University Professor Dr. Parthasarathy and others. So it is a great moment for us, and your contribution we could understand by your experience. It is really unparalleled and unmatched. So such an extraordinary person delivered, and really, because this is the need of the hour, that we have to take yoga scientifically. So really it is a good session, and a few things that I want to quote here. We are all born for the purpose of serving the society. Serving the society is much related to spirituality. Spirituality is nothing but moral perfection and intellectual perfection. That means we have to be spiritual. In that sense, spirituality is not mainly meant for devoting for God like that and all. It is moral and intellectual perfection. See, the peace is the ultimate goal of spirituality. If we are really spiritual, then our actions will be more result-orientedness, righteous and fruitful to the society. So it is our duty to promote spirituality. Spirituality, if we want to promote, there are many tools. One among the tools, or a few among the tools, are science, yoga, and religion, etc. And very particularly, yoga plays like a bridge between the contributions of science and the contributions of spirituality. So really, yoga plays a very vital role to take the contribution of science, and it mingles, it connects both. If we understand and if we use the scientific technological development, definitely we can attain the spirituality. In turn, we can be the useful to the society. For example, the war is going on between Russia and Ukraine. So what is the use? Because if we have moral values, if we have real human values, then only we can be spiritual and we can be an agent for the promotion of society. So peace is the hallmark of spirituality. And these tenets, divinity, and also some other virtues, all are promoting spirituality. For promoting spirituality, indirectly or indirectly, science helps a lot. Yoga also connects the science and spirituality. Why I am telling, as this is the day for Sir C.V. Raman, once Sir C.V. Raman, he indicated that 20th century is meant for science. 21st century is meant for scientific spiritualization, scientific spiritualism. So we need both. In order to attain these two, yoga through science and spirituality helps a lot. You know very well. See, because out of 254 countries, 2 countries are fighting each other. The whole world is parallelized, like COVID-19 pandemic. So many hardships that we could understand, we could undergo. So in order to have, that's why Osho, a great yogi, Osho told, you do meditation so that you can have happiness, so that you can have enjoyment, so that you can have joyful. So if you have joyfulness, if you have happiness, you won't have the intention of going for wars. So in order to overcome these kind of problems, with the help of science, yoga promotes spirituality. That's why he told we need scientific spiritualization. So we are enjoying and we are going ahead of having that spirituality to serve the society. So it is the right occasion to remember a few persons who are excellent in their innovations and discoveries. Edison, Thomas Alva Edison, உங்களுக்கு தெரியும், இன்வென்டர். 1093 இன்வென்ஷன்ஸ் கண்டுபிடிச்சு அவர் பேட்டன் ரைட்ஸ் வாங்கியிருக்காரு அமெரிக்கால. அவர் படிச்சதே 3 மாசம் தான், ஏறக்குறைய ஃபியூ மந்த்ஸ் தான் ஸ்கூலுக்கு போனாரு. மற்றதெல்லாம் அவங்க அம்மா தான் டீச்சர். இந்த 1093 பேட்டன் ரைட்ஸுக்கு காரணமானவர் அந்த தாமஸ் ஆல்வா எடிசன். அவருடைய இன்னோவேஷன்ஸ் இன்றளவும் நமக்கு யூஸ்ஃபுல்லா இருக்கு. நெகட்டிவா எடுத்துக்கிறவங்க எடுத்துக்கிறாங்க, தட் இஸ் டிஃபரண்ட். We yoga, we have to take those inventions in a positive way, fruitful way, righteous way. அதே போல கொலம்பஸ் பாத்தீங்கன்னா அவர் ஒரு மிகப்பெரிய நேவிகேட்டர், செயலர். அவர் இந்தியாவுக்கு வரணும்னு நினைக்கிறார். இந்தியாவுக்கு யூஸ்வலா எப்படி வருவாங்க அப்படின்னா, ஈரான், அந்த காலத்துல பர்ஷியா வழியா இந்தியாவுக்கு வருவாங்க. அவரு நல்லா புரிஞ்சு வச்சிருக்காரு, இந்தியாவுக்கு வந்தா நிறைய செல்வம் கிடைக்கும், நிறைய பெரிய பணக்காரர் ஆக முடியும் அப்படின்னு நினைச்சு இந்தியாவுக்கு வரணும்னு நினைக்கிறார். கடல் மூலமா வரணும், கப்பல் மூலமா வரணும் அப்படின்னு நினைக்கிறார். அப்ப அவர் நிறைய பேரை பணம் ஸ்பான்சர் பண்றதுக்கு அவரு ட்ரை பண்றார். நம்பர் ஆஃப் இன்க்ளூடிங் யூரோப்பியன் கண்ட்ரீஸ்ல இருக்கக்கூடிய அரசர்களை எல்லாம் கான்டாக்ட் பண்றார். வெரி பர்டிகுலர்லி போர்ச்சுகல் அரசரை கான்டாக்ட் பண்றாரு. எல்லாருமே மாட்டேன்னு சொல்லிடுறாங்க. ஆனா அவர் என்ன நினைக்கிறாரு, உலகம் வந்து உருண்டை, அதனால நேரா ஈரான் வழியா வராம அதுக்கு ஆப்போசிட்டா ஜப்பான் வழியா உள்ள பூந்தா எப்படி இந்தியாவுக்கு வந்துட முடியும்ல, அந்த மாதிரி வருவோம்னு நினைக்கிறப்ப நிறைய பேர் பணம் கொடுக்க முடியாது அப்படிங்கிறாங்க. கடைசியா ஸ்பெயின் நாட்டினுடைய இசபெல்லா குயின் வந்து நான் தரேன், நீங்க போங்க, நீங்க கண்டுபிடிங்க அப்படின்னு சொல்றாரு. அவங்க என்ன பண்றாங்க, பணம் மட்டும் கொடுக்காம ஏன்னா நிறைய பேர் விரும்பல வரத்துக்கு, அதனால ஸ்பெயின் நாட்டினுடைய கிரிமினல்ஸ் எல்லாம் இவரோட ஹெல்ப்புக்கு அனுப்புறாங்க. இவரும் கிளம்பி வராரு. 20 நாளைக்கு மேல அந்த கப்பல்ல பிரயாணம் பண்ணிட்டு இருக்காங்க. எந்த ஒரு சேஞ்சும் இல்லை, கடல் தண்ணி தான் தெரியுது எங்க பார்த்தாலும். ரொம்ப சோர்ந்து போயிடுறாங்க இந்த மாலுமிகள் எல்லாம், அந்த கிரிமினல்ஸ் எல்லாம். கடைசியா என்ன சொல்றாங்க, திரும்பி போயிடலாங்க, இருக்கிறது கொஞ்சம் சாப்பாட்டுக்கு கொஞ்சம் தான் இருக்கு மெட்டீரியல்ஸ், அதனால இங்க நம்ம இருந்தா செத்து போயிடுவோம், திரும்பி நம்ம நாட்டுக்கே போயிடுவோம் அப்படின்னு எல்லாம் அடம் பிடிக்கிறாங்க. அப்ப இவர் என்ன சொல்றாரு, இவரும் ரொம்ப பாதிக்கிறாரு, என்னடா இவங்க எல்லாம் இப்படி சொல்றாங்க, நமக்கு ஹெல்ப் பண்ணாம இருக்காங்களே அப்படின்னு சொல்லிட்டு அவர் சொல்றாரு, இன்னும் ஒரு நாள் டைம் கொடுங்க, 24 மணி நேரம் டைம் கொடுங்க, ஏதாவது ஒரு கடற்கரையில நம்ம ஒதுங்கிட்டோம்னா நோ ப்ராப்ளம், அப்படி இல்லைன்னா நீங்க சொன்ன மாதிரி ஸ்பெயினுக்கு திரும்பி போயிடுவோம், ஒரு நாள் டைம் கொடுங்க அப்படிங்கிறார். அந்த ஒரு நாள் கூட அவர் எந்தவித உணவுமே தண்ணியுமே எடுத்துக்காம முழுக்க ஒரு பெனன் ஸ்டேட்ல இருக்கார், ஒரு யோகி ஸ்டேட்ல இருக்கார். அப்புறம் அவங்களும் சரி இன்னும் ஒரு நாள் தானே பார்ப்போம் அப்படின்ட்டு ஓகேன்றாங்க. ஆனா அந்த 24 மணி நேரத்துக்குள்ள 22 மணி நேரத்திலேயே ஒரு கடற்கரையில் அவர்கள் ஒதுங்குகிறார்கள். அப்ப அது தெரியல, அது ஒரு புதிய கண்டம், புதிய நாடுன்னு அவங்களுக்கு தெரியல. பிற்காலத்துலதான் அது தெரிஞ்சது, அது அமெரிக்காவையே அவர் கண்டுபிடிச்சிருக்காரு அப்படின்னு சொல்லி. இப்ப இந்த நிகழ்வுகளை எல்லாம் தாமஸ் ஆல்வா எடிசன், நம்ம கொலம்பஸ் இவங்களெல்லாம் எடுத்து பார்க்கிறப்போ அந்த டிவோஷன், டிட்டர்மினேஷன், டிசிப்ளின் அண்ட் டிவோஷன், டிட்டர்மினேஷன், டெடிகேஷன், இந்த 4 டியும் அவங்கள்ட்ட இருக்கிறதுனாலதான் அவங்க இந்த அளவுக்கு உலக அளவுல பிரபலமாக முடிஞ்சது அப்படிங்கிறது மனதில் வைத்துக்கொண்டு, அந்த அவர்களை போல முத்துலட்சுமி மேடம் போல நீங்களும் வாழ்வில் உயர வேண்டும் என்று வேண்டி விரும்பி கேட்டுக்கொண்டு, வாய்ப்பளித்த உங்கள் அனைவருக்கும் நன்றி பாராட்டி யோகாவை போற்றுவோம். யோகா மூலமாக இந்த உலகத்தில் சிறந்த படைப்புகளை சிறப்பாக வாழ்வதற்கு யோகாவின் மூலம் நாம் மக்களுக்கு எடுத்துரைப்போம், எடுத்து செல்வோம், யோகாவிற்காக நாம் வாழ்வோம் என்று வேண்டி விரும்பி கேட்டுக்கொண்டு, மீண்டும் ஒரு அருமையான, ஒரு அழகான, ஒரு லெபோரியஸ் அண்ட் இன்டலெக்சுவல் பிரசன்டேஷன் கொடுத்த டாக்டர் முத்துலட்சுமி மேடம் அவர்களுக்கு மீண்டும் ஒரு முறை நன்றி பாராட்டி உங்கள் அனைவருக்கும் வாழ்த்தி விடைபெறுகிறேன். நன்றி, வணக்கம்.
Thank you, sir. As I told, that today is very auspicious day and blessed day. We have got the feast like not only in terms of the science as well as the spirituality. Sir and ma'am has proved that both are like both eyes, science and spirituality. So thank you, sir. Thank you, ma'am. And as a students, it is our duty to take a pledge to serve the society with the scientific knowledge, with the spiritual knowledge. Thank you so much for this celebration, sir. And now it's time to vote of thanks. I would like to prefer a vote of thanks. First of all, I would like to thank our chief patrons, Mr. A.N. Radhakrishnan, Chancellor of MAHER, and Mrs. Jayanti Radhakrishnan, Rector of MAHER. Thank you, sir. Thank you, ma'am, who is always supporting us. And I must mention our deep sense of gratitude to our beloved Vice Chancellor, Professor Dr. R.S. Neelakantan. Thank you, sir. And I would like to acknowledge my sincere words to our respected additional patron, Professor Dr. C. Kritika, Registrar of MAHER. Thank you, ma'am. And I am happy to mention my obligation to most valuable chief guest of the day, Professor Dr. Muthulakshmi Paranaraman. Thank you, ma'am, for your valuable words. You are the jewel in the crown of MAHER. Thank you so much, ma'am. And now I offer my sincere thanks to our beloved convener, Dr. R. Ilangovan, sir. who is acting as the energy source and backbone of this Science Day celebrations. Thank you, sir. And next, I thank all the organizing secretary and coordinators. The organizing secretary, Dr. S. Murugesan, sir, the associate professor of FIST, and the coordinators, Dr. V. Sublakshmi, ma'am, associate professor, FIST, Mr. A. Anadure, sir, assistant professor, FIST. Thank you, sir. Thank you, ma'am. And at last but not least, I would thank all our students and our students council, members of the students council. Thank you very much for your sincerity and your presence. So now it's time for the ending prayer.
பிரேயருக்கு முன்னால அந்த ஸ்கிரீன்ஷாட் எடுத்துடலாமா?
Yes,
1
sir.
minute. எல்லாரையும் ஆன் பண்ண சொல்லு.
Yes, sir. So I'm requesting everyone to switch on your videos.
Okay, thank you.
Thank you so much.
Thank you, sir. Thank you so much.
Thank you, sir. Thank you very
Let
much.
us,
Now
let
is
us
the
go
ending
for
prayer.
ending prayer. Ending prayer.
So gently close your eyes. Spine, hands, Namaskara Mudra.
असतो मा सद्गमया तमसो मा ज्योतिर्गमया मृत्योर्मा अमृतंगमया ॐ सर्वेषां स्वस्तिर्भवतु सर्वेषां शान्तिर्भवतु सर्वेषां पूर्णं भवतु सर्वेषां मङ्गलं भवतु लोकाः समस्ताः सुखिनो भवन्तु ॐ त्र्यम्बकं यजामहे सुगन्धिं पुष्टिवर्धनम् उर्वारुकमिव वन्दनात् ऋष्योर्मुक्षीयमामृतात् शान्ति शान्ति
Thank you so much.
Thank you, madam. Thank you very much. Thank you.
So we will meet in future programs. Thank you so much. Have a great day.
Thank you, thank you, thank you all
Thank you. Thank you,
for
madam.
kind cooperation. Thank you, sir.
Thank you. Thank you.
Thank you, sir.